Okay, Dr. Topolewski, thank you for agreeing to do this interview for us. My first question for you is, what has been the impact of integrating behavioral health care into your primary care practice?
Thoroughly positive. People were so ready for this. Many self-referred. Those who we recommended, um, virtually all accepted referral. Some a little bit reluctantly, but they've also returned when it's been recommended that they return. Um, they The usual rate of return on referrals is less than 50%, especially for psychology. And so this has been very high. Um, we believe that we, in some way, don't exactly advertise, but have as a value um, mind body integration. We understand the psychological aspects of illness and life in general. And I think this was a concrete example of that. So the fact that we would share somebody, the fact that we would share a patient, the fact that we trusted has been repaid 1,000 times over. The relief on the faces of people who were struggling has been amazing. I think the view of the person, you have shown the people a different view of life and have taken them out of a position of responsibility that was unrealistic and helped them learn how to um, see things differently, call on their strengths, diminish their weaknesses. And so it's not just that you solve today's problem, but I think you strengthen them in how they'll solve tomorrow's problem and a problem in 10 years. And I think it's been painless enough that they'll come back or they will seek similar help in 10 years.
Great. Do you think that that is a little bit of a different question than I posed in the first place, but do you think that positively affects their health outcomes as well?
I do. I have, many of them see specialists, cardiologists, some see endocrinologists because they need to lose weight and they haven't. And I think since you've asked them some of their developmental questions, they are in a different place, so they're more accepting of change. They're more willing to, or more able to hear without being defensive what some of the suggestions are, and they follow the suggestion of recognizing cues to not making healthy choices, and they make healthier choices.
Great, great. So it sounds like the patients themselves have not only had better outcomes, but they've actually been giving some positive feedback around actually having behavioral health care on site in the primary care practice. Do you sense that they feel more comfortable attending sessions here as opposed to being referred outwards to another agency or organization?
No idea. The jury's out on that. I would
Okay.
love to think that they feel safe here. But I don't think just a little of it is that. I think a lot of it is you and Ashley are doing something that is spectacular for people.
Oh, great. Thank you. Next question I have for you is you're in a practice with many other folks here that get the job done. What's been the feedback from your other staff here around having behavioral health care on site?
I think it's helped us retain staff. They're on the front line. They deal with people under adverse circumstances. They are very flexible, very generous, but there are some people who just keep battering them. Some of those people have accepted referral. Some have referred themselves. So they feel that there's some hope that people will treat them with more respect and reflect the respect that they're trying to show people.
Great, great. And my last question for you is from your personal perspective, what are the most significant benefits that you have seen from integrating behavioral health care into this practice?
Two things come to mind immediately. One is your documentation is phenomenal. I love it when I learn from a consultant, and I love the language and the ideas, developmental ideas, problem solving, all sorts of things. The notes, first off, the notes exist. We don't usually get notes. And secondly, they're educational to the reader. And so I get a better sense of how come the patients come back better adjusted, more willing to work shoulder to shoulder instead of face to face, almost in an adversarial sort of thing. I've got a problem, and what are you going to do about it? It's more, this is how we're going to deal with it. We each have a role. I'm not going to tell you what to do and reject you if you don't do it. We're going to work together and see what works and work around what doesn't work.
Great. So, in essence, it sounds to me like one of the core concepts here is really strengthening a team around the patient that includes behavioral health care.
Excellent concept, yes. Yes.
Great. Thank you very much.
Thank you.
Let's see if it worked. Yes, it did.